Speaker, the House notes that Lassa fever is an acute viral illness that it lasts between 22 and 21 days, during which transmission to humans through contact with food or household items contaminated with the urine or feces of a rodent. Also note that the person-to-person infection and laboratory transmission can also occur, particularly in hospitals lacking in adequate infection prevention and control measures. Further note that Lassa fever is known to be endemic in Benin, Ghana, Guinea, Liberia, Mali, Sierra Leone, and Nigeria. It is also known to be in some other West African countries as well. Aware that on the 21st of January 2019, the Nigeria Center for Disease Control declared an outbreak of Lassa fever, following an increase in the number of cases. A total of 213 confirmed cases were reported in 16 states, including Edo, Ondo, Ebonyi, Bauchi, Plateau, Taraba, Gombe, Anambra, Kaduna, Kwara, the Federal Capital Territory, Benue, Rivers, Nasarawa, Kogi, and also net 40 local governments in all. Also aware that in the reporting week 26, between the 24th and 30th of June 2019, 2 new confirmed cases were reported from 2 states, that is Edo and Benue, with 1 death in Benue. Further aware that from the 1st of January to the 30th of June 2019, a total of 2,882 suspected cases have been reported from 22 states, of which 603 were confirmed positive, 17 probable, and 2,262 were negative. Concerned that since the onset of the 2019 outbreak in the country, there have been 136 confirmed cases of death, thereby putting the fatality ratio confirmed at a total high of 22.6%. Worried that the Benue State Commissioner for Health and Human Services, Dr. Sunday Ombabo, had confirmed another round of outbreak of Lassa fever in Benue State, with the death of a patient in Makurdi, the state capital. Was resolved to urge the National Center for Disease Control and the Federal Ministry of Health to ensure that the outbreak is contained to reduce the fatality ratio in confirmed cases. Also urge the Ministry of Health to create more awareness on the dangers of Lassa fever and to create more awareness of Lassa fever and other communicable diseases to enable the populace adopt preventive measures to avoid contracting the disease. Mandate the Committee on Health Services to ensure compliance and report back to the House within 4 weeks for further legislative action. Mr. Speaker, I hear this motion, you would realize that we have been known to be particularly interested in those rodents that are spreading this fever. It is a point that is very strong to me, that Lassa fever is spread by the rodent, either by the contact with the feces or the urine of the rodent. And this rodent, particularly within Benue, has become a delicacy for my people. It is important that outside of this fear,
he did not mention the name of the delicacy to us.
Mr. Speaker, honorable colleagues, this fever was discovered in the 1950s. By the 1960s and early 70s, it had been known to be found only around Ghana and part of Liberia, a part of Guinea. Lately, cases of Lassa fever have been reported in Nigeria, and you would observe that because of the nature of the disease, before it is discovered with the patient, he's already gone, because the symptoms are very light. Mr. Speaker, it is important that before we allow this thing to become endemic, we urge the ministry and parastatals that are related to this to find preventive and curative measures so that it's not allowed to become larger than it is right now. Mr. Speaker, I urge my colleagues to see this motion as one that will prevent us reaching another stage or another endemic that will be called malaria or HIV. Mr. Speaker, I urge my colleagues to consider this motion as important and let it flow through. I so urge.
Those in favor of the motion say aye. Those against say nay. Let's have it.